Okay, good evening, everyone, and thank you for being here today. I'm Dr. Ahmed Al-Majal. I'm the director of King Fahd Medical City Family Medicine Training Program. So we have you today as a trainees and trainer of Family Medicine Academies. Today we will be speaking in our sixth seminar about how to maintain resilience during the COVID, I would say, times or crisis. As this pandemic, it's brought actually and enforced changes in our lifestyle for most of us, if not all. We know that now we are being susceptible more to burnout and anxiety. Most of us are now currently trying to cope in a situation where it is beyond our capabilities and even control. Whether as a healthcare worker, healthcare providers, we are probably working longer hours or having higher unusual risks, or even as a parents who are looking for their kids and families. Not to mention, of course, the anxiety related to our trainees about their training, their promotions, etc. Or at least being forced to self-isolate, as we did in our curfew or the 24-hour lockdown, which alhamdulillah, now we are off that, but still, we are having the risk. So most of us were forced to self-isolate themselves just in order to be away for those who are caring for. This will put a huge strain on everybody in different ways. Not to mention the social isolation, missing out our usual routines, including our recreational activities, spending the weekends and holidays. Probably the anxiety that comes with all of the consequences of that anxiety, poor quality of sleep or difficulty sleeping, poor concentration, and maybe having an appetite issue are going to have a huge impact on us. So today during this seminar, we will be having the chance to know of some coping mechanism and how to maintain our resilience during these times. So it will be presented for about 40 minutes. So during that time, we are happy to receive your inputs, questions, in public chat or through the private chat, to me directly, so we can discuss it with our speaker. We'll be having like 15 to 20 minutes also chance to probably exchange experience, to have an input, discussion, or even questions by using the mics. Today, we are going to have our speaker is Professor Ciaran, who is a founding director at the RCSI for the Positive Psychology and Health. He is also a founding director of Institutes of Leadership. He's working as a professor of psychology since 1987 until present. And he's having a lot of work to have in promoting the mental well-being, positive psychology. So without further ado, I'd like to introduce Professor Ciaran and take the lead from that. Welcome, Professor.
Okay, shukran Ahmed, and ahlan wa sahlan. It's nice to be here. Salam alaikum, everybody, and thank you for taking the time to come. I know that many of you have been working all day, so it's good of you to be here. Before you listen to me, you might want to know a bit about who I am. Basically, I'm a psychologist. I'm also a pharmacologist. I started my working life in 1979 in a psychosomatic unit in St. James's. And then I joined RCSI in '85 to set up a department of psychology. And that was the first department of psychology in a medical school in Ireland. I then left to set up the Institute of Leadership in 2005. And then last year, we've set up a new center for positive psychology and health. I've also worked in a lot of different sectors as a consultant. And it's a real pleasure to be talking to you in the region again. I started in Bahrain in 1989, and I've been there 5 times a year ever since. And I also set up RCSI Dubai in 2005, and that's still running. So inshallah, I hope a lot of what I say will resonate with you and will fit with the culture. So what we want to talk about really in this seminar is the need for your own self-care. There's quite a literature emerging that shows that health professionals who are caring for patients with COVID-19 are vulnerable. Now, vulnerable not only to the risk of infection, but also vulnerable to a variety of stressors that can result in mental health problems. And Dr. Ahmed alluded to some of them. And I think it's fair to say that the types of stressors depend on you, the type of person you are. It depends on your circumstances, your work situation. And we're also finding that the kinds of stressors change with the different stages of the pandemic. And again, as family practitioners, as trainers, and also as trainees, you're very well aware of this. I recognize that you know a great deal about this already. And I think it's important to say that, you know, there are certain, when we talk about this whole area of psychology, there are certain caveats that I would put in there. The first is that these are not normal times. You know, there are different kinds of times. Everybody is affected in one way or another, not just ourselves, but our colleagues, our friends, our students, our families, our children, our parents. So it's quite unusual in that sense. This is something that affects everybody. And I think everybody responds differently. In terms of developing resilience, there aren't any easy answers, but I think there are a number of principles that are helpful, and that's what I'm going to try to share with you. And I think it's fair to say that in psychological terms, my sense of this is that it's a marathon. It's not a sprint. We're in this for some time to come. And we in RCSI in the medical schools, we're looking at this going out 1.5 years or maybe 2 years in terms of the changes that we have to make. And finally, I would say, I think you're your own best expert. I'm not an expert on your situation. You're the expert on that. So I think you have to take what I say and really think about it in terms of your own expertise, in terms of your own welfare. Now, as I say, there's quite a literature emerging on the kinds of stressors that health professionals are experiencing. I won't go through all of these. And I should say that when we're finished, you will have access to all of these slides and all of the materials. And I've said to Dr. Ahmed and to Brian, if you have any questions that you'd like to follow up on, you know, just send me an email and I'll come back to you on that. So obviously people on the front line are working under increased pressure. For health professionals throughout the world, the fear of infection and the fear of infecting their own families is a particular stressor. Trying to provide care for very unwell patients, particularly if the resources are inadequate. Here in Ireland, we've been reasonably fortunate. Our ICUs have not been overrun, but we certainly had problems at the early stages with PPE. Having to make difficult decisions and feeling anxious about patients. For some people, working outside their normal scope of practice is a challenge. Moral injury is something I'm going to talk about in the next slide, so let me come to that. And there are a variety of other stressors. Many of our students and trainees are finding the disruption in their training a stressor, and the sort of unpredictability of the continuation of their training. So there's quite a lot going on here for people to deal with if they're doctors in this environment. One of the areas that I think hasn't been talked a lot about is this idea of moral injury. And we are concerned about this here in Ireland for our interns and for our young doctors in particular. And the idea of moral injury is it's the psychological distress that results when one sees actions or the lack of them that violate one's own moral or ethical code. And this is sometimes driven by the lack of resources or by the changing nature of the situation or by poor communication. So when somebody sees something that doesn't fit with their own moral or ethical code, that can lead to something called moral injury. And there's some very good literature emerging on this. And that can lead to feelings of anger and shame, guilt, disgust, depression, and can be a contributor to post-traumatic stress disorder. And in some cases, there are a number of reports, particularly in the US, of suicidal ideation being associated with moral injury. So I'll come back at the end and say a little bit about that, but how we cope with that as what our strategies should be. So having established that there's a number of challenges, challenges are particular to each individual responds differently, and each person is their own best expert. I think we can put out a couple of really important key generic ideas that help with coping. And I call these strategic coping strategies. Very, very good paper by Brooks et al. This year in the British Medical Journal, Military Medicine Journal, well worth looking at. Basically, the way the military train for this in terms of helping people to cope with traumatic situations or difficult situations is that if pre-outbreak training allows you to perform effectively, you cope much better. So the quality of training is essential in terms of coping with trauma at the time, but also in terms of reducing the risk of post-traumatic stress. The second generic factor, and as family practitioners, I know you're well aware of this, is that resilience is particularly enhanced by very strong social support from families, from loved ones, from colleagues, from managers. And then the third area, which is a bit more subtle, is that your mindset, the way you think about things, if you adopt a proactive mindset, that has been shown to significantly reduce stress and reduce the risk of post-traumatic stress. And I'm going to say a lot about mindset, but essentially here we're talking about a type of mindset that looks at taking charge of the situation, engaging in proactive behaviors rather than just reacting, accepting the situation, and allowing yourself to face traumatic thoughts. There is a good literature to show that this increases resilience, a proactive approach to dealing with the stressors. Now, there's a huge and really valuable and important literature has emerged in the last 10 to 15 years on mindset and what mindsets are. And I just want to explain that a little bit, and then we'll see if there are any quick questions we can take there, and I'll go on to talk about how mindset actually works. So what is a mindset? Well, the best way of thinking about a mindset is that it's like a lens, a set of lenses through which we simplify the enormous amounts of information that we take in every day about the world and about ourselves. It's really, your mindset is your way of thinking about things, thinking about the world and thinking about yourself. And I like to think of mindsets that are thinking in those situations. It's a bit like a river flowing through, in this case, a wadi. The banks of the river determine the shape of the water. And a mindset is like that. The mindset is like the banks that determine the shape of our thinking. And we're often not aware of the extent to which the mindset is shaping our thinking about things. So Carol Dweck, who's a very famous educator and psychologist, visited the RCSI last year. She wrote this book called Mindset, and for any of you who are interested in this, I really highly recommend you read her book on mindset. Any of you who have children, Any of you who have teenagers, this is really interesting, the work on mindsets in children. And basically, she distinguishes between two types of mindset, a fixed mindset and a growth mindset. A fixed mindset is where you think things are pretty much fixed, where you think your ability is everything, where you think when you fail at something that's a disaster. That's a kind of a fixed mindset. A growth mindset really is a different way of engaging with a challenge. So people with a growth mindset, when they're presented with a challenge, they don't see the problem and start thinking that they can't cope or that they're a failure. Someone with a growth mindset will start thinking, okay, there's a challenge here. I need to engage with this. I need to learn here. I need to see how this has been done before. It's a different approach to a problem. And there's a great deal of research both in adults and children to show that people who adopt a growth mindset put in the extra time and effort to understand if they fail, why they failed. They rebound more quickly from setbacks, and they believe their successes and failures aren't just tied to their talent or their ability, but also tied to their effort. So this is really, really important in terms of the psychology of resilience. So if you shift, or want to shift to adopting increasingly a growth mindset, well, how does that work? Well, there are a few things. One is that we embrace challenges. We take challenges on. When we come up against a setback, we persist. We see the effort as part of the journey. We're capable of learning from criticism. We can find lessons and inspiration in other people's resilience, in how other people are dealing resiliently with a situation. And there's something else really important in healthcare, and particularly in medicine and nursing, and that is, we know from research that health professionals who can tap into, to think about their calling, the reasons they did medicine, their reasons for wanting to help others, their vocation, if we want to call it that. Being aware of that and reflecting on that is a very strong antidote to burnout. And I'll say more about that in a few moments. So before I go on to talk about this in the context of rethinking stress, Brian, Ahmed, is there anything you want me to pick up on at this stage in terms of comment or input?
Not yet, Ciaran. I don't think there's any questions coming through yet, but we will make sure to relay them when they are, okay?
Lovely, okay. Thank you very much. Thank you, Brian. Okay, so what I want to do now is I want to take that idea of mindset and see, is there a way that we can use that to think differently about stress? Now, when I was a young psychologist in training, we were told that the best thing you can do with stress is avoid it or attenuate it, or to deal with the symptoms of stress. There's a lovely course that's been developed in Stanford University based on some very solid research by a number of psychologists there. And this is an approach that looks to rethinking stress and to changing our mindsets about stress. And there's really 3 phases. I've given you the link there. If you go online to the course, it's well put together. The evidence base is solid and it's free. Stanford makes that available free. So the 3 stages are, and there's a lot of material for each stage. The first is acknowledging that we're stressed. So if you're dealing with a particularly difficult situation, starting to acknowledge and become aware of how you're processing that physiologically, in terms of your emotions, in terms of your behavior, that's a really important step. Because what that seems to do is to shift your processing in the situation from limbic or emotional processing to prefrontal cortex processing. We're starting to use information processing, not just emotional processing. So that's the first step, awareness of when we are stressed. The second step in changing mindset here is to try to identify the meaning of and the reason that we're particularly stressed in a given situation. Am I feeling stressed here because I don't want to lose face? because I'm afraid that I'll be shown up not to know everything, because I'll be afraid that I'll be shown up to be weak. What's the deep reason why I'm feeling stress in a particular situation? And then the third part of this, which is really interesting, is to take the energy associated with stress, the psychological, the physical energy, and turn that to use the stress to move towards your goals. Now, there's been some very nice research done with this, teaching people this reinterpretation approach to stress, and it is shown to be very effective in increasing their productivity, decreasing their sense of emotional challenge, and so on. So you can see here we're taking traditional approaches to stress and changing the mindset that goes with dealing with that. And again, as I say, we don't have time to go into it in detail here, but I would recommend that program. I think it's a really well put together program.
Ciaran, we just had a question there.
Yeah, please. Yeah.
We had one about changing mindset, and is there a way? And you've just covered it. But do you see people change their mindset a lot? Like when they engage in this process, are they commonly transitioning from one to the other?
And there's a lot of research evidence on this in children and in adults. The beauty about this is that we're capable of shifting from a fixed mindset to a growth mindset. Dweck in our book gives you some really, really interesting, useful techniques for doing that. And there's a great deal of research to show that people can successfully shift from a fixed to a growth mindset. And really important, small children can as well. Children as young as 4 and 5 years of age can be taught to shift from a fixed to a growth mindset. It's extremely valuable in helping children to cope with stress, particularly school stress, children and adolescents. One of the most important pieces of research really in the last, I would say in the last 20 years in the psychology of stress and growth. Okay, thanks for that, Brian. Is that okay?
Perfect, yeah, thank you.
Yeah, thank you. Okay, so very important report published last year, late last year, by the National Academy of Medicine in the United States. It's called Taking Action Against Clinician Burnout, a Systems Approach to Professional Wellbeing. And what this report is basically saying is that a great deal of well-being among clinicians and other health professionals is due to the structure of the system, the nature of the organization, the quality of the leadership, the quality of its management. And we have traditionally, in terms of stress management, looked to have individuals learn to cope with work-related stress, rather than asking organizations to create better organizations. So this isn't a matter of one or the other, either the organization or the individual. It's a matter of both. And it is really important, and again, there's a lot of research on this. There are many things that our healthcare organizations can do to decrease the stress that's put on healthcare professionals working in those organizations. Now, having said that, there's something particularly important that individual doctors and nurses and health professionals can do. And that is, again, if I'm coming back to this idea of meaning, that meaning and purpose in life are synergistic. So our purpose gives us our meaning. And we know, again, from a lot of good research that this is very important in terms of our happiness and our well-being. Physicians who feel a strong sense of calling, a strong vocation that is strongly associated with meaning. In other words, you get meaning from your life by being of service to others, of clinical service, of helping sick people. That's strongly inversely associated with burnout. So the more you have that sense of meaning in your vocation, the less likely burnout is to occur. So finding meaning in work projects protects physicians and nurses from burnout. And I've given you the references there, and it's a really important piece of research. I'm going to come back at the end to talk about that again when we talk about compassion and how compassion works. Now, in terms of something really, really practical that you can do, I've done it. We get everybody on our programs to do it. Everybody we talk to about this goes away and does it. Most important thing that you can actually do in terms of building your resilience is not to focus so much on your weaknesses or your vulnerabilities, but to focus on your strengths. Now, how do you do that? Well, the best way to do it is to go to this website. It's called viacharacter.org. It's a philanthropic organization based in Cincinnati. They have a huge research base. They give this away free. Their mission is to help people to live more meaningful and happier lives. And they've spent about 20 years identifying human strengths. Now, they have done this in all cultures. They have done it in all parts of the world. They have looked at all of the major religions. They have looked at a whole variety of philosophies, and they have identified 24 human strengths. And they have blocked these strengths into these 7 virtues: wisdom, courage, humanity, justice, temperance, and transcendence. Now, we have used this over the years in the Middle East, in Bahrain, in Dubai, in Qatar, and it works very well in Middle Eastern culture. So this is not culturally specific. So you can log on to the website. Let me just move on and I'll come back to that. This is what the website looks like. It's viacharacter. Over 11 million people have identified their strengths already using this system. You take a questionnaire, that's 220 questions, and you get back a report on your 24 strengths in rank order, from your top strength to your lowest strength. Now, let me just go back a slide there. You will find when you do this that about 4 or 5 of those strengths represent what you feel is the real you. You feel excited about using these strengths. These are strengths that you know are part of your makeup. When you use your top strengths, you're good at them very quickly. You believe that a core strength is one of your core attributes. It's very much part of who you are. You learn very quickly when that strength is being used, and you want to find new ways of using it. And you don't feel tired in situations where you're using one of those core strengths. So to give you an example, when I did this, my top strength is love of learning and curiosity. So that fits very much with the kind of person I am. I really love to find out new things, to explore, to read the literature, to think about new ways of doing things. So that's a very strong strength for me, and it feels right for me. There are other strengths I'm just not very good at. So again, there's a vast research evidence on this, and the evidence says that if you identify your strengths, particularly your top 5, if you're aware of them when you're dealing with challenges, if you're thinking about your strengths when you're dealing with challenges that you're facing, and you're using your strengths as much as you can, that significantly reduces your chance of burnout. And it also significantly increases your sense of fulfillment and achievement and meaning in what you're doing. When you're working as part of a team, it's very helpful to be aware of other people's key strengths, because we're all different. Different people have different strengths. And if you're running a team, if you're aware of what other strengths are, it's really, really helpful to try to structure work so that they're using their strengths, that they're playing to their strengths. I've written about this recently, and you'll find it in the resources on a paper for clinicians here in Ireland. We did this webinar for Irish family practitioners. It must be about 6 weeks ago, Brian?
It's about 2 months ago.
Yeah, and I think there was a huge uptake among family practitioners in going onto that website and trying to identify what their strengths are. Mm-hmm. Again, for those of you who have children, there's a version of this questionnaire for children from 10 to 17. And it's enormously helpful for your children to have them identify what their top strengths are and have them play to their strengths rather than spending a lot of time worrying about their weaknesses or their vulnerabilities. And this is a huge movement now in education. trying to get children to identify their strengths and use their strengths. So this is really important. It's well researched, it's copper bottomed in terms of the data and the evidence, and it's something I really, really recommend. I do it, all my team do it, everybody we talk to, we have them do it, and it makes a difference. It makes a real difference.
Great. So, Professor, if you allow me to enter.
Thanks, Ahmed. Yes.
Because we are speaking about the awareness in which we are dealing, with the stresses. I've got a question about how could we, know that our stress actually is, it seems that he's speaking about the stress performance, curve. How can we know that our stress is really going to affect our performance and it's went from healthy stress, let's say, to unhealthy one?
Okay.
How can we really be self-aware about that? Okay.
That's a really, really good question. So we know that there's a complicated relationship between pressure. So if I think about pressure on the x-axis and performance on the y-axis. So boredom is where there's no pressure and the performance is not that great. If we go up a bit, we get into a comfort zone where we're coping really well. Increased pressure there is actually okay, because that's what we call the stretch zone. So we're having to dig a little bit deeper, try a bit harder, but the pressure here is still positive. It's still improving our performance. We reach this point where extra pressure brings us into what I call the strain zone, where our performance starts to deteriorate. And if the pressure gets even higher, the panic zone is where our performance just drops off. And for each person, the point at which we move from that stretch zone where the pressure is positive to the strain zone where the pressure is now impairing our performance, for each of us that's different. And it's different for us at different times. So some days you can take on anything, and some days something that seems trivial will knock you into that strain zone. So you will know it through increasing error. You're making more mistakes. You're missing information that you normally would see. You're taking longer to make decisions that should be easy decisions to make. You may be feeling a lot more tired and a lot more angry and frustrated. And that's not like you. You're shifting into working in this strain area. And the other piece of evidence you can get is from other people around you giving you feedback. So good teams can give each other feedback, can monitor and say your behavior has shifted, you're under strain here, and let's see, can you move back a bit into this stretch or comfort area. So we all move up and down these areas all the time. It's not good to be spending all your time in that strain or panic area. So they're the indicators. And the final thing I would say about that, there's lovely research now coming out in positive psychology, which shows that positive emotions, experiencing positive emotions like happiness and well-being and joy and love and gratitude, change our physiology in such a way that our range of information processing broadens, we make better decisions, and our productivity increases. Work of Barbara Friedrichsen, University of North Carolina, a lot of research to show that by inducing positive emotions, our capacity to perform goes right up. Really, really solid, again, research. Is that okay, Ahmed?
Great.
Okay, thank you, shukran. Okay, so before I come on, I'm going to say a little bit about leadership. I just want to talk about post-traumatic stress disorder. And again, as clinicians, you're very familiar with that concept of post-traumatic stress disorder. I don't know whether you've heard the term post-traumatic growth. This is a term that has emerged really in the last 10 years or so, largely from research by a number of people. The best known would be Tedeschi. And the research has reached a stage now where there's a handbook for post-traumatic growth. And the idea here is not everybody who goes through a traumatic situation experiences post-traumatic stress. It's quite variable. Some people, when they cope with trauma over a period of time, actually find that their lives are more meaningful. if they've been able to make a contribution to helping others during that traumatic or challenging time, that creates for them a sense of meaning. For some people, their sense of their relationships with family and with others that they love improves. So for quite a high number of people, traumatic situations and traumatic stress actually results in something that's now called post-traumatic growth, not post-traumatic stress. So the kind of steps here are trying to understand one's own response to traumatic situations, working with others to reduce anxiety about dealing with trauma, constructive self-disclosure, and that means talking to others about how you're feeling. And I think Schwartz rounds, I'm not sure if Schwartz rounds are being used yet in the kingdom. I've given you a reference on that later, using Schwartz rounds. Creating a narrative, being able to tell a story to yourself and others about how you're feeling, what you're experiencing, and what it means to you. And then keying in again into your life principles, the principles by which you're living your life. And again, I think in the culture, that's something that works within the culture in the region. And I think that's really, really helpful. It is not inevitable that people who are dealing with traumatic situations will experience subsequently post-traumatic stress disorder. I think it's useful. It's very useful to know that. I want to come back around and just briefly speak about moral injury, because I raised this. And again, this is the injury caused when somebody sees something that they don't feel happy with ethically, that it goes against their own beliefs or their own values. And, you know, in a lot of parts of the world, I know that in some countries where they're overwhelmed by COVID and by the pressures on resources, difficult decisions are being made about treatment and the allocation of treatment. A lot of research here again, and the evidence is that frank discussion about decision making is very important here, why particular decisions are being made. Strong support by supervisors and strong team support is important. We see something called team huddles, where difficult decisions are being made. The team gets together and helps make the decision rather than one person making the decision and telling the team. Regular contact among the team to discuss decisions and to check on each other's well-being. And then post-crisis active monitoring and support where necessary. And probably the best way of doing this, and we have them now here in Ireland, are the Schwartz rounds. And there's a lot of literature on that, and I've given you a lot of resources on where to find out about. It may well be that Schwartz rounds are now available in the centres and in the hospitals in the kingdom, but if not, I think it's something certainly that's worth looking into. Okay.
Can I just bring you back there, Ciaran, for a
Yes.
moment? There's just another question, and it's really about what you've been talking about.
Yes, Molly, yes.
They're just specifically asking about signs of post-traumatic growth.
Yes.
And how to differentiate that from post-traumatic stress, really.
Okay. Well, signs of post-traumatic growth, I mean, it isn't that the individual hasn't been traumatized or has had to live through trauma or has experienced very difficult situation. That post-traumatic growth also comes from that. But the differences are, we're aware of post-traumatic stress disorder, so disturbed sleep, anxiety, hypervigilance, you know, of having difficulty switching off, projection onto others, and so on. And it's a well set, it's a clear classification there. Post-traumatic growth is where the person recognizes that, yes, I have been through a difficult situation. It has been traumatic. I have seen things that are traumatizing, and I have felt traumatized, but you know, I contributed to that. My sense is I made a contribution there. I used my skills. I was as effective as I could be. It makes me more appreciative of my own life. It makes me appreciate more my own relationships. It has changed for me the importance of my values. So the things that I thought were important are not quite so important, and maybe some things I didn't think were important, are important for me. And I'm growing through working through and processing my experience of the traumatic situation. So it's quite a different trajectory. The work by Tedeschi, and I've given some references there, is really, really good on this. And it kind of links to the next slide, which is really something that again, we're getting so interested now in, and this is the idea of empathy and compassion and the difference between the two, and this is important. So I've written a long paper on this last week. We'll make it available because there's a lot of resources and so on there. We are taught in health, the health professions are basically taught to empathize with somebody's suffering, but not to do it to too great an extent. You've got to keep a certain professional distance there, and that's fine. What empathy means is recognizing another person's feelings, when someone is suffering, understanding their suffering and feeling for the other person. That's empathy. Now, the problem with this is that if you're showing empathy a lot of the time, that can lead to burnout. Because you're taking on the pain, you're taking on the other's pain. The antidote to burnout in this situation is compassion. And what compassion means is taking action to help the other person. So there's a difference. These words are often confused, empathy and compassion. Now, what's really interesting, they've taken some very good neuroplasticity studies looking at monks, Buddhist monks who practice compassion meditation. And they've shown the literature that if you're feeling empathy for another person, some of the areas of your brain that are actually active are your emotional sense, the limbic system areas of the brain. In these monks who practice compassion, the reward systems in the brain light up. They're quite different in terms of the parts of the brain that light up when one is feeling empathy and when one is feeling compassion. So the research evidence that's emerging now is absolutely fascinating to show that by showing compassion with empathy, by taking action, which is what health professionals do, that is an antidote to burnout. And the second part of this is it becomes very important to practice self-compassion. And that means applying the same kind of compassionate care that one would apply to patients, for example, applying that to oneself. Now, in the resource that we'll give you, there's a lot of literature, a lot of the research, including the neurobiology research on that. So I think that's important for us to bear in mind that distinction. Now, finally then, I want to just briefly say something about leadership, because I understand, Ahmed, that there are a number of people on this call who, are either in leadership or developing into leadership positions. When I ran the Institute of Leadership, we looked at a huge range of leadership theories. But on our Masters in Leadership programs, this is the leadership theory that we actually taught people, because the evidence base for this is better than practically any other leadership theory. And this is called authentic leadership. And somebody who's an authentic leader basically shows these 4 types of characteristics. The first is that they've spent time getting to know themselves. They've done a lot of work on themselves, so they understand their own strengths and their own weaknesses. The second is that the authentic leaders operate from a moral principle, an ethical standpoint. They do the right thing. So they're guided by their values, by their internal moral perspective. They regulate their behavior based on their values. I'll come back to say why these are important for followers then, dealing with somebody like this. They are genuine and compassionate, so they're not playing a game. They're not pretending to be something that they're not. The person is the real person. So you have a sense with a leader like this that you're not seeing somebody who's different in a whole variety of different situations. They're the same person. They're genuine. You're seeing the real person. And finally, authentic leaders are fair-minded. They will take input. They will listen to what people have to say, and they will balance their own agenda with the wishes and needs of other people. Now, we know from a great deal of research that this type of leadership is incredibly effective. And why is it effective? Think about what it's like to be led by somebody like this. You're being led by somebody who knows themselves, they've worked on themselves, they know their strengths and weaknesses. They'll operate from their values, and you know that they'll do the right thing. So if you know what their values are, you'll know how they'll behave. They're genuine, so you're seeing the real person, and they're compassionate. They look after their people. And finally, they're fair-minded. They'll take inputs. So the beauty about this kind of leadership is that it builds trust. You get a great deal of trust between the follower, the person being led, and the leader. So if we take that into the current situation, and you're looking at then supporting your own team's well-being, I think what comes from this, an authentic approach to this, is to do a number of things to ensure that staff receive good quality communication and accurate updates. Being compassionate means rotating people from high stress to low stress functions, not having somebody in a high stress situation all the time. Partnering inexperienced workers with more experienced colleagues, using a buddy system. So again, when people are facing into this difficult environment, putting together experienced people with perhaps less experienced people, watching stress levels and reinforcing safety procedures, encouraging and monitoring work breaks. In China, in Wuhan, in the hospital there, when this started, the hospital management after a few weeks went to the physicians and the nurses with a very detailed questionnaire on stress. And you know what? What they actually needed was somewhere to rest, to eat, and to sleep. They didn't need a whole lot of psychological input. They needed somewhere. What they really needed was somewhere to sleep when they were coming off shift. Ensuring that staff know and can access mental health and support services. And then for managers, you know, we're role models. We're role models of self-care. So I think it's becoming ethically important that people in leadership roles look after themselves, look after their own health, because more junior people will model their behavior on what more senior people do. So once again, when we take this into leadership, I think authentic leadership is the kind of leadership that we need, not just for this COVID crisis, but for healthcare as we go along into the future. I'm just coming to the end here. Is there anything you want me to pick up? We will have time for questions, but if there was anything you wanted me to stop on just now.
Yeah, Ciaran, as we are speaking about the leadership,
Yes.
I'm having one question here from the participant. How about if, you know, the leadership itself is not really an authentic leadership that might really actually being part of the pressure that is happening around? How could we, as a teams, they're coping with such?
I know, and sorry, and that question comes up. I can tell you that question comes up all the time. In all cultures, we get it. So when we bring people onto the clinical leadership or the Masters in Leadership programs, the question we're most often asked is, I'm learning all about this, but my boss doesn't know any of this, and my boss isn't this kind of leader. So you're actually really being asked to manage upwards, to manage your leader, manage your boss. And I think there are a number of things that are important there. The first is ensuring that you've got very good social support, that your own network, your own team is very supportive, and you're not leading in that way yourself, because what happens in organizations, we tend to adopt the leadership style of people further up the line. So you've got to look at questions about your own leadership style. Is that the same or is that different? The second then is, I think, in terms of managing upwards, it's anticipating how that leader thinks, the kinds of things they need, the kinds of things that put them under stress, working that out and responding in a way that actually helps the person in charge deal with the stressors that are on them. It also is partly to do with understanding that there may be stresses coming on them from above that are not obvious to you further down the line. But I would say if you took a survey of what are the most common stressors in healthcare for people, the things that come up all the time are having too much to do, being overloaded, and my boss's personality and the way my boss leads. And the final thing I would say on that is that if you can at all encourage the leadership in the organization, all of them, to do leadership development, because we've been doing this for 15 years, and what we find is that a lot of senior people are very surprised when they start leadership development to find that there's so much they didn't know, that they were leading in one particular way, whereas there were other ways of leading that were much less stressful for them, but also for their people. Yeah, there's a good literature on managing upwards. Maybe we'll find one or two of those papers and make those available after the webinar. The last thing I want to do, and we will have time for some other questions, and I think this will work with across culture. I hope it will. I'll explain it in advance. We've been talking about mindsets and applying mindsets to stress management, to burnout, to leadership. There's a wonderful poem. It's an English poem from the Victorian era. It's called Invictus. And Invictus is the Latin word for unconquerable, cannot be conquered. And the poem was written in about 1870 by a guy called William Ernest Henley, who, when he was an Englishman, when he was 12 years of age, he got skeletal tuberculosis and lost his left leg. And he coped with that, but unfortunately at 24 years of age, he was told he would have to have his right leg amputated. And Henley was operated on by the famous Joseph Lister in Scotland. He spent 3 years undergoing very difficult and complex surgery. He was in hospital for most of that time. And he wrote this poem, Invictus, or Unconquerable, about his response to his treatment, his difficult and painful surgery, the tubercular infection, and trying to cope with the difficulties that created for him. You might know the name of the poem from the film, the movie Invictus, about Nelson Mandela, where Nelson Mandela becomes president and wants the South African rugby team in 1996 to win the World Cup. When Mandela went to Robben Island prison for 27 years, this was his favorite poem, and he read this poem to his fellow inmates in Robben Island prison. And I think it's wonderful. For me, it captures the key idea of what a mindset, a resilient mindset is. And I'm just going to read it through for you. It's written in Victorian language, but I think it's okay. In the last verse, there's a line that says, "It matters not how straight the gate." Straight in this context means narrow. It matters not how narrow the gate. So what I'll do, if you'll allow me, I'll read it and you can tell me if it makes any sense or not to you. So this is the poem Invictus, and it starts, it says, "Out of the night that covers me, black as the pit from pole to pole, I thank whatever gods may be for my unconquerable soul. In the fell clutch of circumstance," means no matter how bad things get, "I have not winced nor cried aloud. Under the bludgeonings of chance, my head is bloody but unbowed. Under the pressures of chance, my head is bloody but unbound. Beyond this place of wrath and tears, beyond this place of anger and tears are crying, looms but the horror of the shade." That means death. So beyond this place of anger and tears looms death. "And yet the menace of the years finds and shall find me unafraid." I'm not afraid of that. "It matters not how straight the gate. It matters not how narrow the gate. How charged with punishments the scroll. How many difficulties I have to go through. I am the master of my fate. I am the captain of my soul."
Yeah, I think it's describing the mindset of
Yeah.
the
There's a lot of Victorian language in there, but I think the idea is there that no matter, you know, mindset is really about, it's not what happens to us, it's how we interpret what happens to us and then how we engage with coping what happens to us. That's the real key to mindset. And that's the most important thing now in terms of resilience.
Do you think, Professor, that just in quote unquote, that mindset or the way of dealing with the things is I mean, can be, I mean, transmitted to the people who are surrounding me? I mean, let's say in my small, you know, health team, worker, I mean, just positive mindset with my colleagues.
Absolutely, absolutely. Yeah.
Time.
So let me give you an example of that. It can be a big issue in medical school, you know, because when people go to medical school in most countries, usually there are people who have done very well academically in high school, and they're very used to succeeding, and they're used to succeeding based on talent. For many of them, they reckon it's their abilities that get them there. Then they get into university and medical school and so on, and they find that the standard is higher, and there's lots of people there who may be better than them, some worse. So sometimes people with a fixed mindset in those situations can find that they're not doing very well because they expect it to be easy because they're so talented. And they don't take into account the amount of work that has to go into study and exams and effort and so on. So what Carol Dweck would say, you'll often see somebody with a talent, say in athletics or something, but they never excel because they never put in the work needed in combination with the talent to excel. People with a growth mindset, that's what they do. They say, okay, I might have some talent, but I've got to work at this, I've got to make the effort, and if I make a mistake, that doesn't mean I'm a write-off or I'm a washout or I'm a failure. That means I learn from that and I grow, and the next time I'm in that situation, I'll do it differently. So I think, to answer your question, Ahmed, sharing some of these ideas about mindset with a team, working on that, looking at where we get into fixed mindset, where we complain, say, about a situation rather than trying to fix it, for example. We know that from research in positive psychology, if you can identify the people in the organization and in the team who bring positive energy, they are very useful people. They're very important. There are plenty of people who bring negative energy, who bring the team down, right? If you can identify the people who bring positive energy, if you start each meeting, for example, with the positives, what's gone well, not immediately into what's gone badly, and finish each meeting with the positives, you could start to change the dynamic of the culture. So you're getting a more positive orientation. You're not ignoring the issues that need to be addressed. You're getting more positive orientation, and you're also starting to shift into this growth mindset. And the final thing I would say about that, one of Dweck's greatest ideas, I think, is that your fixed mindset is very often the voice in your head that says negative things to you. That I failed here, or that I didn't do a very good job there, or I'm going to fail, or I'm going to be late. Dweck suggests giving that voice a name, that you actually name that voice. And every time that voice comes out to speak to you, you say, there you are, such and such, extra. I call mine Tulkinghorn, after a very nasty character in a Charles Dickens novel. He was a nasty lawyer. So when my fixed mindset voice is coming out to talk to me in my head, I say to Tulkinghorn, there you are again. Once you start to recognize the voice, you start to see where you're starting to move into fixed mindset. You pull out and you shift back into a different way of thinking. And it works. It's extraordinary. It really works. We're teaching all of our medical students now in the medical schools, all of our medical schools, Bahrain, Dublin, Penang, and Perdana, about mindset.
Yeah, that's great.
Yeah.
Any question from our distinguished participants, guests? You are most welcomed even to share your experience by raising the hand and using the mic, if any.
Ciaran, can I just say, I mean, we have most of the group here today, I think, are residents. So they've been through quite a lot. They've all been working, you know, over the last few months, as all our own trainees at home have been, in very difficult situations. And they've, you know, they've been pulled out of training for a while in order to help with the all of our healthcare systems have faced. And I suppose just sort of on a level, a personal level for them, if you like, what kind of advice would you give them now that hopefully things are coming a bit under control and that they're maybe hopefully getting back towards normal, back into training, to just get their heads back into a space for moving forward, I suppose?
Yeah, thanks very much, Molly. And that's a really good question. I think there are a number of things. I think one of the things that can actually happen is in the acute phases of this, people are very busy and it's all hands on deck. And sometimes when that pressure comes off a little bit, you get to reflect on what those experiences were, and that can be a bit difficult. There's a couple of things. I think monitoring oneself for signs of, you know, anxiety or depression is important. In our culture, substance abuse is quite a risk. I think that's less a risk in the kingdom, but for some people it may still be. So I think there'll be a group of people for whom emerging from that difficult period will be quite difficult. They'll have missed a lot in family, missed a lot with children, missed a lot with parents, missed a lot of family time, may well have experienced, you know, seen difficult decisions and traumatic decisions, and maybe at the risk of what we talked about there, moral injury. So self-monitoring, I think, is very important. I think if people feel they're in that situation at that more extreme end, really need to go and talk to somebody. I don't expect that will be the majority of people. For the rest, I think focusing on some of the ideas around post-traumatic growth, I think is helpful. So how do you process? What kinds of things stand out? Discussing with other members of the team, discussing with colleagues, I think is very important. And then I think as people move on then to the next phase of their careers or the next phase of their training, making meaning out of those experiences and carrying that meaning into the next stages of professional development is helpful, because I think that gives meaning to the experience, that the clinical experience gained during that period actually is extremely valuable for the next phases of training and practice. They'd be the big things that I would point to.
Thanks, Ciaran. Yeah.
Thanks.
Thank you.
I'm having a raising hand from Dr. Ahmed Andijani. So, welcome, Ahmed. Ryan, could you just unmute?
Hi, good evening.
Hi, good evening.
Yeah.
Thank you very much for such a wonderful presentation. I'm sure that most of us agree that this is a really unique presentation out of the thing that we're used to as a resident. I don't actually know how to start. I think I'm gonna just start by introducing myself. I am resident R4. I'm also the chief resident, been chief resident since R1. I've been through this crisis, which seems to be, as I elaborated, and I don't take this lightly, it was one of the worst days in the beginning in my life. Most of the residents, I think they feel the same. I always say that the problems should be looked at it as subjectively, to see the impact on the individual, but not seeing the problem itself. And we should be non-judgmental when discussing such things. So I would believe that most of the residents felt the same way. My experience was being the supervisor in one of the quarantine. Been sleeping there like for 24 hours for almost 2 months. It's funny because I realized once I reached the R4, I'm not going to do any on-calls. But that was the longest on-calls since my medical career. I'm just going to share two things. I really like, I like reading a lot about the mindset and how to deal with the difficult situation and how to set up your values and principles. and reading about the life crisis, existentialism. But the two things that struck me really hard, that moment when I've seen the people starting to listen to me and to feel that you bear responsibility and that you're responsible of any decision that you're going to take. I'm guessing that was the hardest part. I don't know how I passed that. I agree with you, having a really good social connections, my friends, I owe them so much. I also, it might sound hypocritical saying this now, but I really owe a lot to Dr. Ahmed Al-Majid. He's been there with me all the time. That helped a lot, honestly, supporting wife as well and supporting family. Focusing on doing what you think is right, but again, you will go question yourself, what if the thing that you think about is not right, it's wrong, and you're still doing it? Because we could discuss that the right thing is debatable and relative as well. That was difficult, but I passed. The thing that was so difficult, I was surprised by it, I was cursing every day that I want to go back home. Once that happened, I was disappointed. I feel like I don't want to go home anymore. This is my new place. I was laughing with my friend. I told him, like, it's like Stockholm syndrome, like falling in love with the one who kidnaps you in somewhere all around. But this place was such a hell to me. And I just wanted to go back home any day. But once that happened, it felt so fast. It felt like everything was gone. Then you start to think that everything in life is the same way. You think that everything is difficult. You think that everything can stay forever, but it's done. It's done. You just go back home. Everything is the way it used to be. I agree with you that one of the things that I felt is to find meaning, that what you did was meaningful. Even though if people didn't recognize that, even though if people didn't pat you in the back and say, good job, but at least it was meaningful that you did that all. But still you'll feel that empty void after you go back home. You feel depressed, you feel like you don't want to do anything. I mean, give an example of this meeting I wanted to attend from the beginning. I was hesitant, like I didn't feel like doing anything, but I'm like, my friend was like encouraging me, so glad I attended this. I decided for myself, like I spoke to my friend, that we need to meet up after we go back home to at least feel related to what happened. But the thing that helped the most, that having good people around you, like that, we take that for granted, honestly. I just wanted to share what happened and to put weight on what you're doing. And this is, we always say that we need to look things holistically, but this is actually what matters, the mindset. And I think this is what differs us from other creatures. And that's why we bear a lot of misery, because we obtain such wonderful gifts from other creatures. I really enjoy your talk, Doctor, and just wanted to share my experience here, and maybe could relate to what you said by the experience. Thank you very much for listening.
Ciaran, well, Ciaran. And can I just a very brief response? Can I just express our sense of solidarity from Ireland and from the College of Surgeons with you all there, you know, in facing into what has been probably the most difficult experience of a lifetime for these generations. You know, these are very strange times. One thing that struck me when you were speaking there, we did a lot of work in early years with post-traumatic stress disorder in physicians, nurses, and in paramedic groups. And in those days, when I was working with that, we used to use a thing called a critical incident debrief. You know, where you'd go in as experts, get people to say what they had experienced, what they'd seen, what they felt when they saw that, what it meant to them. And we had been doing that for a number of years until a large Cochrane collaboration review came out to say that not only does that not help very much, but it actually makes things worse. And what the research evidence says is it's much better for colleagues to talk to colleagues about that and to talk to others who have been through similar situations, to use the infrastructure, the support that exists within the team or within the organization. So I think in terms of the adaptation, and there'll be a period of adaptation coming back to normality or whatever normality is going to be coming through that, the kind of conversations that people can have with each other who have been through the same situation is incredibly important, and no expert from outside, I think, can match that.
Yeah, sure. Thank you, Ahmed, for sharing that experience. I mean, I'm biased speaking about Ahmed. He's the chief resident in our training program, so I'll just leave that. Okay, so if we haven't any input, questions, or participation, we have brought here, a couple of appreciation. From some of people, Dr. Zainab, Dr. Azzuddin, Dr. Hanan. They are really appreciating the time and the effort. Thanking you from Dr. Abtihal about this such a presentations. It's really much needed, nowadays. I would like to just assure all that we are going to share all of the content, the resources with you right after the seminar. So any inputs from you, Professor Molly, Brian?
Can I just say, Ahmed, thank you very much for hosting and for running this meeting today, and very much to Ciaran. I heard this talk or a similar one with the ICGP about 2 months ago, and it really does bear repeating. It's something that I could, and every time I hear Ciaran speak, I learn something new. And I really just want to thank Dr. Ahmed very much for sharing his experience with us, because I feel that it is quite most likely reflective of many of the people who are here today. And as Ciaran says, I think the support that you can give to another is also going to help you get through this, So that's all I have to say, apart from reminding everyone that we do have a masterclass tomorrow as well. So don't forget to register if you aren't already registered, and we will see you there tomorrow afternoon, hopefully. I don't know if Ciaran, if you want to add anything, or if Brian had anything he wants to add.
Just for me to say thank you to Brian and Ahmed. It's been a pleasure meeting you both. A pleasure to make your acquaintance, Ahmed. I spent a lot of my life going back and forth to the region, and it's a great pleasure for me, and indeed an honor to be able to talk to colleagues in the region. I wish you all well. If anybody wants to email me with any particular questions, please feel free to do so. And if there are other resources that we can put together for you, we'd be very happy to do that. I want to also thank the ICGP for the invitation, and IHEED and Brian for facilitating. So it's been an honor. Thank you very much.
Thank you very much.
Okay, thanks everyone. Bye. See you soon.
Yeah, thanks, Ciaran.
God bless.
Thanks, Ciaran. Thanks, Ahmed. Thanks, Brian.
Ma salama.